Depression is a leading cause of disability, affecting nearly 10% of adults in the United States, yet, it's often misunderstood. Why? Because depression is a mental illness, not a visible physical ailment. Let's clear up a big misconception. Feeling sad isn't the same as having clinical depression. Sadness is temporary and usually tied to specific events. But clinical depression? It sticks around for at least 2 weeks and impacts every part of life: work, play, relationships. How can you tell if it's depression? Look for these symptoms: a persistently low mood, loss of interest in activities, changes in appetite, feelings of worthlessness, sleep disturbances, poor concentration, restlessness or slowed energy, and recurrent thoughts of suicide. If you or someone you know has 5 or more of these symptoms, it's time to seek help. Depression isn't just in your head, it has physical effects too. The brain's frontal lobes and hippocampal volumes can shrink. Neurotransmitter pathways involving serotonin, norepinephrine, and dopamine may get disrupted. Even circadian rhythms and hormone levels can go haywire. What causes depression? It's a complex mix of genes and environment. There's no single test to predict who will develop it. Now, the tough part: seeking help. On average, it takes 10 years for someone to reach out for mental health support. But there are effective treatments available: medications, therapy, electroconvulsive therapy, ECT, for severe cases, and transcranial magnetic stimulation, TMS. Supporting someone with depression? Encourage them gently to seek help. Offer practical assistance like finding therapists or making lists of questions for doctors. And most importantly, don't compare their experience to temporary sadness. Open conversations about depression can reduce stigma and make a huge difference. So, remember, depression is real and treatable. If you need help, reach out. You're not alone. Thanks for watching.